I'm Hanin Khundukar. Today we will talk about Sturge-Weber syndrome. Let's start about this case. A 3-year-old girl is brought to emergency department due to first-time seizure. The patient was watching television 30 minutes ago when her left arm began twisting, which progressive to twisting in all four extremity and loss of consciousness for 1 minute. Medical history is notable for receptive and expressive language delay. Vital signs are normal. The examination shows a sleepy but irritable toddler lying on the bed. An erythematous patch is presented on the right forehead and upper eyelid, which her parents say has been presented since birth. There is a light brown macula with irregular border measured 0.5 centimeter in the abdomen. Skin examination is otherwise normal. The visual examination relieves the left hemianopia. Neurological examination is otherwise unremarkable. Which of the following is the most likely diagnosis in this patient? Okay, is it capillary hemangioma, neurofibromatosis type 1 or type 2, or Sturge-Weber syndrome, tuberculous sclerosis? If we, in the key point in this case is port wine stain in the erythematous patch presented in the right forehead and upper eyelid. This is the key point for Sturge-Weber syndrome. As we said, is it facial port wine stain distributed in the first and second branch of trigeminal nerve. But when we talk about the by exclusion, if it capillary hemangioma, is not presented by seizure or neurological deficit, and neurocutaneous disorder like a neurofibromatosis type 1 or type 2 or tuberous sclerosis. Tuberous sclerosis is association by another dermatological manifestation like hypopigmentation and age-left spot and angiofibromatosis. And neurofibromatosis type 1, it's related to intellectual disability and seizure, but having another picture like neurofibromas and axillary wrinkling and coffee-olate. When we talk about neurofibromatosis type 2, it's mostly affected cataract. But when we talk about Sturge-Weber syndrome, in this case, this patient has a facial port wine stain and new onset seizure finding concerning Sturge-Weber syndrome. Sturge-Weber syndrome is the neurocutaneous disorder characterized by capillary manifestation. Its distribution of the first and second branch of the trigeminal nerve, which is association by leptomeningeal capillary venous malformation affecting the brain and eye. The patient with Sturge-Weber syndrome have a variable intellectual disability, which is may presented as developmental delay in the infant and early childhood. A seizure, as this case, mainly in early childhood and often organizing focally or subsequently generalized. And this patient, hemiparesis contralaterally to the intracranial malformation, may present at time of seizure. Glaucoma is the most common intraocular abnormality in the Sturge-Weber syndrome. However, vascular manifestation involve the occipital lobe or the optic tract can also visual field defect. For example, this patient's left hemianopia or visual loss in the left visual field of both eye, resulting from the lesion involving the contralateral visual pathway. When we diagnose, we do an MRI of the brain with contrast to detect the intracranial vascular malformation and is diagnostic. When we treat the patient, we treat symptomatic treatment that's aimed at controlling the seizure and reducing intraocular pressure. Laser therapy may also help to reducing the appearance of the port wine stain. As a flashcard for the Sturge-Weber syndrome is a neurocutaneous disorder that affecting GNQ gene Clinical features, as we say, port wine stain affecting trigeminal nerve, branch 1 and 2, and leptomeningeal capillary venous malformation, a seizure with hemiparesis that affecting contralateral of the lesion, intellectual disability, and visual field defect, also glaucoma. Diagnosis by MRI, management symptomatic as a laser therapy and anti-epileptic drug or intraocular pressure reduction. As a conclusion and hope message, as this is seen in this picture, the patient can present by seizure, port wine stain, and a visual field defect, and intellectual disability, and have a characteristic features in the MRI. Sturge-Weber syndrome is a neurocutaneous disorder, the capillary manifestation of port wine stain along the trigeminal nerve distribution and leptomeningeal capillary venous manifestation affecting the brain and eye, and seizure, intellectual disability, and visual field defect can occur. Thank you.